Today I want to talk about research on the impact of hyperbaric oxygen therapy on body, brain, and mind. Hey everybody, Chad Cruiser here with Health and Homestead. So I'm going to go through the experience of going through a hyperbaric oxygen therapy treatment, and I'm going to tell you what it's like, what it feels like. Is it scary to be in a confined space? And so it will give you an idea what it might be like for you. I want to begin by looking at some of the research on hyperbaric oxygen therapy. Let's start with a study on Alzheimer's. A study in the journal Alzheimer's and Dementia looked at 42 people with Alzheimer's and 11 people with amnestic mild cognitive impairment. It was found that hyperbaric oxygen therapy significantly improved in the patient's mini mental state examination at both 1 and 3 months. Now, this is one study specifically on Alzheimer's and mild cognitive impairment, but what about dementia in general? A meta-analysis was reported in the journal Frontiers in Aging Neuroscience looking at the impact of hyperbaric oxygen therapy on vascular dementia. And they looked at 25 randomized controlled trials with nearly 2,000 people. They report that there is a striking improvement in mini mental state examination. They went on to say that the improvement of hyperbaric oxygen therapy is indisputable. And a lot of times in studies or meta-analyses, they use terms like, well, there's a statistically significant benefit. But in this particular one, they say it's striking and indisputable. So it seems to make a serious impact, but this simple, I would say, quasi-natural remedy may make a significant benefit. But what about PTSD? Research in the journal PLOS ONE looked at the impact of hyperbaric oxygen therapy versus a control group on veterans with PTSD. They tested the veterans on the Beck Depression Inventory and did functional MRI scans to look at their brain function. And those on the hyperbaric oxygen therapy would do 60 sessions at 2 ATAs, which are 2 atmospherics absolute. And it turned out that there was a statistically significant benefit in their levels of depression and PTSD. And the fMRI revealed an enhancement in the brain microstructure. So on the scans of these veterans, they found that it actually changed the microstructure of the brain. I actually heard Joe Namath, how he had at least 5 concussions, and he started to maybe notice some negative impacts. He really had seen the negative impact on a friend who had been an old NFL player. And so what he did was he ended up going in for hyperbaric oxygen therapy treatments, and they did brain scans, and they found that part of his brain was hardly functioning. But after many hyperbaric oxygen chamber treatments, his brain began to function properly once again. Well, here's hyperbaric oxygen therapy and depression. But it's an interesting study where researchers looked at patients who had spinal cord injuries and sought to see the impact of hyperbaric oxygen therapy on their mental health. They divided the patients with spinal cord injuries into 3 different groups. Those with conventional rehabilitation were the control group, a second group had psychotherapy, and the final group did the hyperbaric oxygen therapy. The psychotherapy group had a statistically similar benefit with the hyperbaric oxygen therapy group. Those 2 groups had a statistically better impact than the control group. And additionally, the group with the hyperbaric oxygen therapy had the best nerve function and functional independence. Now, I don't know that we could totally take this study to say it works for depression in general. These are very specific cases of people that had spinal cord injuries, but in their case, it was at least as good as psychotherapy, but then it had a better impact on their physical healing. The next area of research we're going to look at is burn wounds. Research in the Annals of Medicine and Surgery tested hyperbaric oxygen therapy against a control group, and they found that hyperbaric oxygen therapy shortened the duration of time the patients needed to be in the hospital and lowered the amount of complication from the burns. Now, the next category of research is hyperbaric oxygen therapy's impact on hearing loss. Research out of JAMA reports on a meta-analysis of studies on the impact of hyperbaric oxygen therapy's impact on sensory neural hearing loss. This is a type of hearing loss that comes from the inner ear being damaged, in some cases by being exposed to long periods of loud noise, or maybe loud noise in general. And they conclude by saying that hyperbaric oxygen therapy makes a statistically significant impact on restoring hearing loss in this form of hearing loss. And it looks like they did 10 to 20 sessions at 2 to 2.5 atmospheres. These are just a few of the things that it may work on. Now, the things that specifically the FDA has approved the treatment of hyperbaric oxygen therapy are these right here. Hearing loss, we talked about that. Another one is severe anemia. For certain people who have tremendous problems with anemia, they may not be able to take a blood transfusion. This is a way that they can actually help them with their anemia. Now, the burns, as we already mentioned, this is something that typically they want to try to take the individuals who've been severely burned within the first 48 to 72 hours to give them this therapy. The next one is carbon monoxide poisoning. I actually had an experience where I and my family had carbon monoxide poisoning. In the middle of the night, the entire family almost simultaneously began to have both vomiting and diarrhea. And I'm so thankful my mom thought of it, because you might just thought, oh, we must have eaten something bad and stayed home and, well, died. But instead, my mom thought, I wonder if it's carbon monoxide. And sure enough, that's exactly what it was. We'd have the furnace replaced. We could have died. It's a terrible experience. It's like terrible diarrhea, terrible vomiting at the same time. It's going out both ends. It's just a really bad experience. But this is something that can be helped with hyperbaric oxygen therapy. The next one is carbon monoxide poisoning with additional cyanide poisoning. I mean, talk about kicking someone while they're down. You have carbon monoxide poisoning and cyanide poisoning, but this is something that can work for both of them. Also, general wound healing. That general wounds, some wounds, maybe like diabetic wounds that people struggle to have heal, or some other kind of wound, maybe a pressure wound from someone who's been in a wheelchair for a long time and it hasn't been noticed. In these kind of situations, hyperbaric oxygen therapy can hasten the healing process. Well, I've just signed my life away before I go into the treatment, and we're gonna go give it a try. You have to wear 100% cotton because there can be sparks with other kind of synthetic materials, so I have to change into some scrubs before I go in. So before you actually take the therapy, you have to sign away your life that if you die, you know, it's not their fault. And so I get in there and somebody says, well, I hope you don't die. And then they wheel me into the machine, and once I'm in the tube, I look up at the screen. There's a TV screen there, and it says the day I almost died. So what was it like? I can say that it was very enjoyable being in there. It's very, very peaceful being in the chamber itself. To me, there was no claustrophobic experience whatsoever. The only unusual thing that I had was I had like a tingling feeling in my fingers. I don't know that I had it in my toes so much, but really no negative experience. And they told me afterward that I could have brought a book in there. I would have way rather had a book in there. I think that'd be much nicer to just have this very quiet place with just very peaceful and be reading a book. And so I think that would be a great way to do it. And so if you really need this for something, you have one of the issues that's been shown to be benefited by it. The only negative really that I can think of in general is that it's not cheap. And so thinking about that, I paid like $100 for 1 hour, and it was an hour under, so it's like 2 hours, because it takes a while to bring you to the right atmospheric pressure and then to slowly release it. Now, if you're a person who struggles with plugging your ears, like if you've been in a plane and your ears get clogged or something like this might be something, if you've just been sick, not to be doing it. But if you don't have any trouble with that, and I don't have any trouble with that, if you're someone who knows how to dive and unplug your ears, it's not a problem at all. I didn't see any problem with it. That's something you need to take into consideration. But really, it was a great experience. And so if you need it, check it out. But really, some of the other methods, even though they've been shown repeatedly to have significant benefit, aren't yet passed by the FDA. But the great thing is you can go to a clinic. Many of the clinics will let you go without even a doctor's order. You just pay the money and you can go and try it out for yourself. If you like this video, hit the subscribe button, hit the bell notifications. God bless and have a fantastic day.